Hello all. Today I want to share my experience of one-to-one or face-to-face therapy sessions with the online therapy sessions. Due to COVID-19 crisis and the pandemic everywhere, most of the therapists and most of the therapy centers have shifted their attention towards online therapy modality or online therapy mode. So I thought of putting up this video to compare my experience with one-on-one therapy sessions to online therapy sessions. To simplify the topic and for larger clarity, I thought of comparing the effects of one-to-one therapy sessions with the online therapy sessions, to talk about the disadvantages of online therapy sessions, and to talk about the advantages of therapy sessions. So let us start with the comparison for both types of therapy situations. In first point which I would like to speak about is the physical presence of the therapist, which is there during one-to-one therapy session, is not there during online therapy session, and that makes a huge difference in the therapy outcome. So the therapist is physically present in one-to-one therapy sessions, whereas in the online therapy session, therapist is present in some corner of the room, on the laptop or on the mobile. So this is one thing. The second thing is therapist is in charge of the therapy session during one-to-one therapy session, and the therapist is not in charge, but some family member or some caretaker is in charge during online therapy sessions. Task arrangement is according to the therapist during one-to-one therapy sessions, whereas during online therapy sessions, therapist is not able to arrange the task the way he wants, but he has to depend on the caretaker or family member for the task arrangement. When therapist is arranging the task, therapist takes care of many things like the amount of light and the direction in which the child should be facing, or the posture the child should be acquiring, or the base on which the child is sitting, whether it is appropriate or not appropriate. So many factors are taken care of by the therapist when he is arranging the task, and this advantage gets missed when the child is going through online therapy sessions. Another thing is regarding reinforcement. So when a child does something for some specific behavior, during one-to-one therapy session, instantly he is rewarded or punished. So that instant factor is missed during online therapy session. By the time therapist conveys the caretaker or the family member about the reinforcement that he has to give to the child, situation is gone and the child is not able to learn about his behavior. So this is major difference I feel in both the therapy modes. Another thing is the physical presence of the therapist is a reminder to the child to be sincere all the time during therapy session. Whereas when a therapist is on the laptop or on the mobile, that physical reminder of sincerity, of dedication or discipline is missing during the therapy sessions. So this is what I could vaguely compare of one-to-one therapy session with online therapy session. So let us now talk about the disadvantages according to me about the online therapy session. Disadvantages of online therapy sessions, which I have come across many a times during my online session, is internet fluctuates. So internet fluctuations will break the continuity of the session and the session gets ruined. Misinterpretation of what therapist says and what the parent understands or the caretaker understands, so that misinterpretation ruins the session. Miscommunication to the patient. Whatever I say, the caretaker understands something, conveys something to the patient, and that miscommunication makes the situation chaotic if the therapist and parents do not have that kind of rapport where they understand each other regarding the therapy. Children with physical issues, in those children, therapist is not able to make proper biomechanical analysis. Whether he is keeping one shoulder up, whether he is moving his waist somewhere, whether he is not weight bearing properly. So all that information does not reach to the therapist properly. So that is one big drawback of online therapy sessions, I feel. Sensory environment, therapist cannot take care of the sensory environment. Since therapist is not present during that therapy session in the room, therapist is not aware about the temperature of the room. He is not aware about the noise, or he is not aware about the other factors that is influencing the therapy. So that sensory environment is beyond therapists' understanding in online sessions. Occupational therapists are trained to utilize the environment for therapeutic outcome. So during online session, therapist is not able to do that. Therapist is not able to use the environment at the right time for the right purpose, and the utilization of the environment for therapeutic outcome definitely gets suffered. Uh, Another thing is monotony of the home and routine of the household chores. All that affects the treatment, and all that affects the therapy. Child does not feel any different than being in a therapy, than being in a home, and he is there for therapy. So that differentiation the child cannot appreciate, and the therapeutic outcome suffers. Task modifications are compromised in online sessions. The therapist is not able to modify the task instantly as per the requirement of the child. By the time the therapist will convey it to the caretaker, the thing is gone. The situation is gone. So I think these are the major disadvantages of online therapy sessions. So let us talk about the advantages of therapies, online therapy sessions. I feel online therapy would work in cases where psychotherapy is required, where merely talking can help the child or the case to recover. So it is definitely beneficial for, I guess, psychotherapy. Another thing is it is helpful for children who follow commands and children who are obedient. So online therapy session definitely will help children who are very obedient, who love to take challenges thrown by the therapist, and who will follow therapist very dedicatedly. So those children will definitely benefit. And all the equipments or game that therapist needs for the therapeutic outcome are present at the home. So if those things are available at the home, then only online therapy sessions can help the child. And therapist and parent should have that rapport, where a therapist is conveying something and the parent picks it up and gives the similar result that therapist would have got. So that rapport, that understanding between parent and therapist is the key to online therapy sessions. Another thing is parents should be able to modify the task according to child's need. So if they understand or learn that thing from the therapist during one-to-one therapy sessions, they can implement it well during online therapy sessions. So I feel whatever advantages I have enumerated, if those factors are present, online therapy sessions can be helpful to children. We should also forget that during pandemic, we do not have any other option but to go online many a times. But definitely, according to me, that can never substitute one-to-one therapy sessions. During one-to-one therapy sessions, the therapist knows how to utilize his voice, tone of his voice, pitch of his voice to get the required behavior out of the child. The therapist knows how to use the environment to get what the therapist wants from the child. The therapist can adjust the sensory environment. The therapist can do many things when he is physically present with the child, and the rapport of the therapist and child can give you wonders that you seek. So I hope that this information helps you in deciding what you want to do about the child, but do not take any risk. During this pandemic, do follow all the sanitation and social distancing norms and keep yourself safe. Take care of your child, follow your occupational therapist advice, and my personal suggestion would be, as far as possible, try to get in touch with your occupational therapist for one-to-one therapy.